later, all right? So this is what my students call the move, all right? It doesn't refer to Seinfeld. It only refers to the thoracolumbar junction. I tend to adjust from L3 to T11 from an A to P direction. I rarely adjust the upper lumbar spine in a rotational manner in side posture. All right? I'll adjust from L4 down in side posture. Everything else gets done A to P, just because of the alignment of the facets. It's hard to do. If you use this move and you get the timing down right, it's actually easy to do. All right? I came up with this by chance, just about 9 years ago, and I've been doing it ever since. All right? And it's worked very, very well, especially with patients with that thoracolumbar facet problem. A lot of patients with the thoracolumbar facet problem get radiation down into the SIs. It almost looks like an SI problem. I've taken many patients with SI symptomatology. We do this move on them, get the thoracolumbar junction going, their SI pain goes away. And it's just through muscular attachment that they get the radiating pain. So whether it's their QLs, whether it's their erector spinae, whether it's the multifidi and the fascial sheaths going down into the dorsal sacral ligament because of the chronic tensioning in that area, once you release the thoracolumbar junction, the SI pain goes away. All right? So I tend to look above and below, just using normal, good exam protocols. We're going to use a fist contact. I took these pictures in haste, so what's missing there is the towel. Okay? The towel is key. All right? You don't quite need a towel this big, but if you have a normal sized bath towel, not the large bath towel. All right? So if you go to Walmart, okay, $3, get a towel. All right? It beats spending $100 on a Tepper wedge. All right? If you use the contact correctly and you keep a nice tight fist contact, students usually have a concern about hurting their hand. That's why they don't want to do this maneuver. I've been doing it for 14 years. My hands are fine. The only pain I have in my hands is from athletics. I've been doing ART for 10 years, and I've been adjusting for 14, and my hands don't bother me except for anything I've done on an athletic field. So you can do this safely without much problem, male, female, small person, big person.